Psoriatic disease is a lifelong condition that causes skin plaques and joint pain. While there is no cure for psoriatic disease, there are medications available to help control the symptoms. Sometimes, the news of having psoriatic disease can come as a surprise, as the skin plaques may be hiding in less visible areas of the body. For mild cases, a primary care doctor may be able to prescribe topical medications, but more severe cases may require treatment from other specialists. So, it's important to seek the right medical care to manage psoriatic disease effectively. When you're diagnosed with psoriatic disease, you'll likely see a dermatologist for skin symptoms and a rheumatologist if you have joint pain. As a rheumatologist, I often receive referrals from primary care doctors, dermatologists, and sometimes pediatricians. It's important to note that about 30% of people with psoriasis will eventually develop joint inflammation, usually about 10 years after their initial psoriasis diagnosis. When this happens, a dermatologist will refer them to a rheumatologist like myself for further treatment. A collaborative approach between a dermatologist and a rheumatologist can provide the best care for people with psoriatic disease. Depending on how psoriatic disease affects you, you may need to see other specialists. For example, some people with joint inflammation may also experience inflammatory eye problems or intestinal issues later on, requiring the expertise of an eye specialist or gastroenterologist. When meeting with your doctor, especially during your first visit, it's important to come prepared with questions and details about your symptoms in order to receive the most comprehensive care. When you visit your doctor, especially for the first time, make sure to come prepared with a list of questions and details about any symptoms you may be experiencing, even if they don't seem related to psoriatic disease. Your doctor will want to know if they should look into other areas, such as your eyes, gastrointestinal tract, or nails. If you're experiencing joint or back pain, it's important to ask about getting evaluated by a rheumatologist. It's important to find out about the specific medications you'll be taking, including how often you'll need to take them, the method of administration, possible side effects, the goals of treatment, and how soon you can expect to see improvements in your symptoms. The treatment plan will vary depending on your diagnosis and condition, but generally, everyone with joint inflammation from psoriatic disease should be taking medication unless there's a specific reason why it would be risky for you. Most individuals will start to feel at least 50% to 75% better within the first 3 to 6 months of therapy, and even better beyond that. While remission, meaning no joint swelling or pain, may not be possible for everyone, it is still the goal to strive for, as it can greatly improve your quality of life. Make sure to schedule regular check-ins with your doctor, especially if you start experiencing joint pain, stiffness, or swelling. It's important to keep an eye on any changes in your symptoms, as psoriatic disease can be aggressive and cause long-term damage. If you notice any new symptoms like inflammation in your eyes, diarrhea, or blood in your stool, it's important to see your doctor. These could be signs that the disease is affecting more than just your joints, and you may need a different treatment to address these symptoms. Psoriatic disease can be challenging, but it's important not to underestimate its impact on your body. It's crucial to find the right medication to manage your symptoms and keep you comfortable. Don't be afraid to discuss your concerns with your doctor, as there are many different treatment options available.